Hi everyone, my name is Robert Haddo with Full Spectrum Training Systems, and I'm here to talk to you today about low back pain, actually, kind of a condition that's near and dear to me. So if we want to look at the impact of low back pain, we kind of have to understand how it's affecting the low back and what low back should be able to do versus what movements are exhibited when someone's suffering. See, a healthy low back, we should be able to move through our full range of motion through flexion, through extension, to side bending each way, and be able to rotate comfortably each way. The key here is full range, comfort, and the ability to meet our resistant demands day to day. So the ability to lift with enough force, the ability to twist with enough force to meet our activities of daily living, be those activities something as pedestrian as taking something off the top shelf, or maybe we train Brazilian Jiu-Jitsu. Those output needs need to meet those demands. And so we have our basic component movements. Now, the back pain today we want to talk about is called idiopathic low back pain. We're basically not sure what happens. So this isn't necessarily injurious, although having had an injury years ago can be a big part of the cause of this. But often people have this with no cause. So we call it idiopathic. It means we have no idea. But they might wake up one day and they can't roll over. They can't twist. They can't move. And the pain's so high you can't breathe. And you're looking at days or weeks per episode. And you're looking at a really high instance of recurrence if you've had an episode. Like the majority of people who experience low back pain like this are likely to experience it again within the next, I think, year or so. And so we want to talk about what we can do about that. When you're experiencing this low back pain, I mean, obviously you have pain. We have spasm. The muscles that contract around the spine are tightening down. The central nervous system is telling them, fire like crazy. Your range of motion thus drops because of those two things. It hurts to move, and maybe you just can't. Our main go-to, weirdly enough, isn't medication for this. There's no injury. The central nervous system is interpreting the movement and use of the back as being threatening. And so it's creating a pain output saying, don't do that. And our best approach to addressing that is actually educating it. We call it movement exploration. We want to take this very painful state and now methodically break down an approach here. So right in here, we can come over to a very basic approach. And it's not set in stone. The exercises I'm about to mention, they're just throwaways. You pick and choose. You have to find which exercises work best for you. You have to find the approach that works for you. This is just an example of a way to break it down, and it's one that I personally tend to find very effective. So we start safely. We want to start exploring our range of motion. Like I said, we can't move very much. So we want to explore what is available, and we want to try to increase that pain-free range or decrease the pain within our existing range. Both of those are wins. So our goal is kind of to decrease spasm here. We can look at something basic like camel cat exercises, where we lay on all fours, we go into all fours, and we arch our back up and extend it down to try to explore that range of flexing, extending, that sagittal plane movement. We can go to side lying stretches. So we would lay on our side and we actually twist and reach up and try to really open up that rotation through that transverse plane, as well as some side bending in the coronal plane. It's a combined movement and trying to really open up that combined movement. We can look for standing reaches, so a side bending, a pure side bending. It's not truly pure because when you rotate and side bend, they are coupled, but we want to try to stand up and just touch the outside of each knee as far as we comfortably can. Our goal is to explore to our pain limit, to our pain experience, and try to gradually, as we go through more repetitions, increase that range. We can also look at approaches like appendicular into axial skeleton, so using the shoulders and the hips, the limbs, into the trunk to generate movement. A really effective one I tend to really enjoy and find effective is the 90-90 approach. So we're seated on the floor using our legs each way to generate more side bending, rotation, and some flexion extension through the spine with control. And these are all relatively non-weight bearing. They're very basic exercises. They're not weight augmented, they're very safe. And we use these to gradually explore our range, increase our range of motion. When we have our range increased, we want to now bounce over and add resistance to it. And this isn't like a multi-day thing. This is all same session. We want to work our range up and now add some strength to it. We want to add some muscle recruitment, add some resistance training. And generally accepted, the most effective exercise for that is basic deadlifts. Good form, good control. Through whatever range you have comfortably available, and you load up with whatever weight is safe and comfortable for you, and you push hard. You try to now encourage muscle recruitment, encourage your central nervous system to have awareness of all those kinetic chains and all those neuromuscular components and say, actually, yeah, I can use that safely. You actually increase the volume of signal it's getting from it in a safe manner to override its output to the back saying, ouch. We can look at upward and downward dog training, a yoga-based approach, where we're working through flexion extension of the spine again from the hips and the shoulders and actually bracing at the glutes at the top of the spine and bracing at the shoulders at the bottom of the spine in our downward dog position, upward dog position, to flex and extend the spine with input from the limbs. We can do things like Russian twists. They're a great simple exercise for rotation through the lower back, through the core. Generally accepted as a core exercise, but a big component exercise for our daily needs. Glute bridges, a nice simple body weight exercise with a resistance component. Again, flex and extension. Some people say, oh, I can't bend forward, it hurts too much. Well, this is a great way to reduce that pain in forward bending. We do standing one-arm rows. So anchor a weight or resistance source off in front of us, holding, and turning and pulling with the back. This gets a little bit of side bending. It's mostly rotation, but inclusion from the hip complex and the shoulder complex. These are all very beneficial to add resistance safely. Our last approach, our most kind of complicated part, is rate training. All the movements we talked about here, they're pretty simple movements. They're planar movements. We flex and extend in our sagittal plane. We side bend in our coronal plane. We twist in our transverse plane. They're all very pure, simple movements. Our daily life is not like that. And so when we actually start getting into the stuff we want to do to duplicate more daily living, we actually get into more complicated movements. Things like dancing, things like running, like baseball, like swinging a baseball bat, or climbing, martial arts. So we have things like plyo training. That's a gym-based explosive power training approach. It's acceleration, deceleration, so it's rate training. We have sports. They demand a high change in velocity quite often and changes in vector. Things like running, a repetitive sport with a high demand on essentially impact specificity. Or medicine ball training, things like medicine ball slams. And again, these are not all-inclusive. There are so many choices for this. The key here versus these ones, if that'll actually work, these are more applicable when you're in pain. They're great when you're not in pain. They're still effective and they're still very useful for general health. These tend to be more applicable for decreasing the intensity of pain later, for decreasing the incidence of pain, making it so that it may be less likely to have that same pain episode from something so simple like, again, reaching for a purse or a soother. If you've trained your body to have a lot more movement control off axis, a lot more movement control changing vectors and ranges, then you've trained your body to be more resilient to those things that may have caused that sudden shock of pain, that sudden shock of, I have no idea why this hurts so much pain. And this all just comes back to our approach to movement exploration. It's just a simple methodical approach. For your lower back pain, explore your range and increase it. Explore your resistance with that range and increase it. Explore your rate control within that range and increase it. Decrease your pain per incidence, decrease the number of incidents per year. Thanks very kindly.